You're listening to Health Professional Radio with Wayne Buckler. Today in our Health Academy series, I'm talking with Paul Butterworth. Now, Paul is at Southern Cross University and he's the course coordinator in Podiatry. Paul, welcome to Health Professional Radio.
Thanks, Wayne.
Paul, just for those listeners who aren't familiar with Southern Cross University, you're located in Queensland, Australia. What campus are you on?
Well, Southern Cross has got three main campuses. There's one at Lismore, Coffs Harbour, and they've just opened up probably over the last 2 years, their new campus on the Gold Coast at Balinga, just on the airport grounds. So that's where I'm based, on the Gold Coast.
I see. Now, tell us a little bit about your area of interest.
Clinically, my interest is in foot surgery, and in research, my interest is in looking at systemic factors that influence foot pain, so particularly obesity and mental health.
That's an interesting mix of things that most people wouldn't associate with foot pain. I mean, obesity instantly makes sense to me, but mental health?
Yeah, look, we conducted a study with some physios, rheumatologists and podiatrists down in Melbourne, and we looked at 62, I think, people with foot pain, and then we followed them up over 3 years, and we wanted to see what factors predicted whether their foot pain got better or worse. And so at 3 years, what we actually found that it was the people with poor mental health to begin with, their foot pain was more likely to get worse and deteriorate than get better. So I think conditions, if you use depression as an example of a mental health disease, depression's highly correlated with a variety of different musculoskeletal conditions. And, it's certainly an area where a lot of research is occurring.
That's very interesting. And obesity, as I said, was obvious to me, but was there any findings there that surprised you?
A little. I think it makes sense that the more weight you carry, the more vertical load and force you're going to have on your feet, and it's not going to be helpful. And, obesity has been historically strongly associated with knee problems, knee osteoarthritis, osteoarthritis in weight-bearing joints. But obesity is also associated with things such as carpal tunnel syndrome, which is a non-weight-bearing joint in the hand or the wrist. And so we sort of wanted to find out, well, why is that the case? So what we did was we looked at total body mass and its effect on foot pain, but we split it up into fat mass and fat-free mass. So we're talking about fat, and then the fat-free mass is, muscle and bone and so on. And what we basically found was that it's actually the fat mass component of body mass that predicts people having foot pain. And the theory is that fat as a tissue is responsible for creating a lot of inflammation. So it may well be that people with foot pain, rather than it being simply due to increased mechanical load on the feet, that in fact it's a metabolic problem because of the increased fat itself.
There's certainly some room there for further research and study, isn't there? That's not what I would have thought as the kind of obvious conclusion.
No, well, it basically means you can take two people with the same body mass index, so the same height and same weight, and they could both be obese. But of those two people, it's the one who's got the higher fat mass that's going to be more likely to get foot pain. So what this means really is that, we need to look at the effect of weight loss on foot pain, and it would make sense that if you can lose weight, then it will help your foot pain, but it's more about losing total body fat that's important.
That's, as I say, one of those interesting findings that I didn't expect. And I should say, Paul, that things that I don't expect to be found in medical research are legendary. It's not my area at all. You're listening to Health Professional Radio. My name is Wayne Buckler, and I'm in conversation with Paul Butterworth, the course coordinator in podiatry at Southern Cross University. Paul, what are the things that you think our audience as clinicians should be the attention getters that they should be paying attention to?
With regards to foot pain, or foot deformity, I think that whether you're a medical practitioner or allied health practitioner, I think there's a few important things. I think one of the biggest problems with foot pain and foot deformity is that it increases the risks or the risk of falls and balance problems, particularly in elderly people. So I think identifying elderly people with structural foot problems such as bunions and hammer-toes and these things, people with really high arch feet are susceptible to foot pain, and identifying those people and combining other or looking at other risk factors for falls and balance problems such as polypharmacy, other gait changes, use of walking aids, and so on, will help clinicians identify those patients at risk, and I think from there making sure these people get the advice, education and treatment they need could potentially help reduce falls and balance problems, because falls in the elderly is one of the major causes of trauma-related death in the elderly, more so than motor vehicle accidents, for example. So it's a bit of it's a significant burden on the Australian healthcare system. So I think identifying those issues is important.
That's a very significant point, isn't it? It's a bit scary to think that your feet may be more dangerous to you than a motor vehicle if you're a bit elderly.
Yeah, well, that's drawing a bit of a long bow, but I see what you mean. Yeah, it's definitely a problem.
Paul, what do you see coming over the horizon in the future in podiatry?
What do I see coming over the horizon? More foot problems, I think. I think that if we go back to the issue of obesity, there was a study done as part of the Australian Diabetes Obesity Lifestyle Study. It's a NHMRC funded 12-year longitudinal study that has produced a whole range of publications on the topic of diabetes and obesity. And basically one of those papers has predicted that by 2025, which is only 10 years away, that only 28% of the Australian population will be of normal weight. So it'll actually be abnormal to be of normal weight. So if you consider the association between obesity and foot pain, if obesity is on the rise, then there's going to be more people with foot pain. And so I think just, if I'm looking at the horizon, hopefully if someone like myself and other colleagues in my profession can help to educate other professionals who perhaps don't have a great understanding of foot pain, then that can only help the community.
That's an interesting observation, and one that when you explain it seems axiomatic, but until you explained it, didn't seem obvious at all. Paul, thank you for talking with us today on Health Professional Radio. As always, when I talk to experts, it's astonishing what a clear insight you can bring to the conversation. So thank you for your time. A transcript of this story will be available on Health Professional Radio, along with a sound archive of the interview. I've been in conversation with Paul Butterworth, the podiatry subject area coordinator for Southern Cross University. Paul, it's been good to chat to you. With a little bit of luck, we'll come back and talk to you again. Thanks for your time.
Thanks very much.